everyone, it's Dr. Rick, founder of Herbal411.com, and today's unboxing is going to be on iron. This is Easy Iron by Natural Factors, and I like this because number one, it's chewable. That's how big a chewable tablet is, and each of these is 20 milligrams, which is not much to ask with regards to an iron supplement. If you are watching this and you're not my patient, you should probably ask your physician about how this pertains to you, because this is not meant to be a substitute for medical advice. But some folks are borderline low, or just actually low, like a menstruating female, somebody who's just had surgery and lost a lot of blood, or somebody who does not have the components, as I mentioned before, for building red blood cells and hemoglobin, meaning plant-based usually. Plant-based practitioners, I honor them, and I was vegan for about 3 years. Because I don't menstruate, even being vegan, I never checked my iron levels until recently, and I was on the low side of normal, which is unusual. So I tried to use the Floridex. Unfortunately, the Floridex is compromised. That's the liquid iron, and it is liquid, and it usually causes less constipation than your average iron. And spoiler alert, that's a side effect of iron. But the problem is that if you don't refrigerate the Floridex, it is really bitter tasting because it's iron. So if I would put the liquid in the fridge, I'd always forget it was there and I wouldn't take it. This is a little different because it's available in chewable form. You can keep this outside the fridge, but you can also keep this with your other vitamins. And the other cool thing with this is that if you take this at night, in some cases, if you have restless leg syndrome and you're borderline low on your iron, iron can actually help restless leg syndrome. The one caveat with Easy Iron is that it does have stevia. But stevia, some people don't like, and it says stevia from leaf powder, but it doesn't really say if it's processed, where they get it from. The problem is that those of you who are afraid or have IBS or leaky gut, or afraid of upsetting the microbiome because of a sugar substitute, well, stevia is the most natural sugar substitute, but in some instances and studies, any sugar substitute, that means an alcoholized sugar, that does not trigger diabetes, that's kind of good, but it can destroy the microbiome. I'll probably do another video on how supporting the microbiome will help inflammation control and great hormones and proper digestion and great metabolism. And I have done other videos on my gut series, but there's manipulation now of the lining of the gut and then the microbiome or bacteria in there, and then what you take in toxin-wise every day. And it's a big subject, but bottom line is that iron side effect equals constipation in your average iron. That would be Feosol, 325 milligrams once a day. We would give that to women that were pregnant, and that was probably in the 90s. But again, if you're not losing blood menstruating, and if you're not plant-based, and if you don't have major surgery or trauma where you've lost blood, the likelihood is whatever you were given as far as iron stores when you were a kid will probably maintain with you all throughout life. I was very surprised that my iron was on the low side of normal, but I'm attributing that to the decrease in iron intake during my 3 years of being a vegan. So it can be argued that a male should have a full workup for where's the iron going if you're on the low side, but the hemoglobin in your bloodstream gets recirculated. So thus, iron is used in hemoglobin, that's the red blood cell, to make it red and carry oxygen. And when you have an old red blood cell go to the spleen kind of culls and pits all the old cells, takes the little center of the red blood cell, which is the hemoglobin, and puts it into a new cell, and it's brand new. So iron is never lost. The only theoretical reason for losing iron would be menstruating, massive trauma, or not having the building blocks when you were a little kid. Then the controversy is that why should we even take iron? And here's a couple papers. This is one that just showed how if you're pregnant, that you can benefit from iron, but the data said that with the iron supplementation, depression was improved, which is novel. I would not say that anybody with depression just rely on iron, but in some small cases it helped with depression. So it could be that if you're on the low side, again, document first. You take it and it fixes things or makes life better. This is just the mention of, in animal studies, restless leg, where if you do have a restless leg issue, that's when at night you just can't sit still. The legs move a lot. It's irritating to sit still. You got to get up and walk around. You can have muscle cramps, but that's technically termed restless leg, and I'll probably have to do a video on that. But those of you who have difficulty with that kind of symptom, if you do iron, as long as you check your iron and ferritin level first, it might give you improvement. And I always thought that was a novel idea, and I would think, well, if somebody doesn't have iron deficiency, doesn't have anemia, why should we be giving them this big, it's a big tablet, but actually it's a big mineral as far as the periodic table goes, compared to smaller elements in life. But that's the one problem, is that because of the positive charge and because of the size of the iron, it is very irritating to the gut. Again, mentioning of iron's usefulness is pretty good with the perceived exertion. So, perceived exertion is when you go and exercise and suddenly you're, whew, that's really tough. Well, obviously with humans, you can figure out and measure if you have a level of perceived exertion and then you take iron. The level of perceived exertion in this study showed that distance runners had an improvement in their performance. So it might be worth it, but the only problem is this study was done with IV iron. That's when you go to a hematologist and he puts an IV in your arm and then the iron goes in that way. There are some dangers with that because all that positive charge at once is very irritating to the blood vessels and can cause problems. But in some patients that have heart disease and diabetes or renal failure, and then they also have iron deficiency anemia and they can't take oral iron, you have to fix the iron because, again, it's the transporter in the blood of oxygen from lung and heart to the rest of the body, the brain, the kidneys, the skin, the muscles. And if you don't have enough of that transport, you will be fatigued, the brain won't work right, the skin will fall apart, the kidneys will fail. So it's important to have good oxygen. It's also good to have red blood cells, meaning if you're deficient, fix it. And how do you figure it out if you're deficient or not? Check levels of iron, ferritin, and a CBC. That's a complete blood count. So hopefully this gives you a couple of ideas. Those of you who already use iron and you have a side effect, this might help you. Again, as I mentioned in the beginning, this is only 20 milligrams, which is not much compared to the big iron tablet that they sell over the counter, 325 milligrams. But if the 325 causes problems, and this doesn't cause problems, and sustainability of this is longer and better, I would do this. Consistency is better than intensity. So if you're doing a sudden burst of iron intake and you have diarrhea, constipation, belly pain, fine, good for you. But if you're going to need this for the long run, like you're plant-based or you are menstruating female, I think this would be a good compromise. So this does have that stevia in it. It does taste good, so it makes it yummy. And I would keep this away from children because it does taste so great. So hopefully this gives you a couple of ideas. Consider subscribing to my YouTube channel if you want to hear other videos like this. Otherwise, I'll see you at the next video.